can say that the disease has continued to spread. Is that correct?
Absolutely.
Well, now, how is it that oftentimes it's almost as if the disease does not exist in many of our media? For example, sometimes you rarely see anything about it in the newspapers, and at other times there's quite a bit of information. I mean, why is this ebb and flow in reference to it, giving us the impression really that it's not as much of a problem as perhaps we claim that it is?
Well, it's a significant problem. It's a worldwide problem, and it's not going away. And that's the ironic part of this is it's a disease which, if we applied everything we knew, technically we could stop it right now, but we're not. Why does the media handle it and sporadically? I think it's who comes out and admits it. Obviously, when a Magic Johnson says, "I've got AIDS," it's going to make major headlines. When an Arthur Ashe dies of AIDS, that's going to be significant. And very basically, the media picks up when there's a major event, either someone coming out and saying, "Hey, I'm infected," or someone like a Ryan White who for years was kind of plagued, but in his death surrounded himself with a lot of people who championed the cause. And so these types of events tend to bring it to the forefront. The fact that people are dying every day, unfortunately, isn't news. It is to us, but it isn't to the media.
Ms. Emmons, from your experiences as a nurse dealing with this disease, let's have you to give us some information relative to children born with the disease and the way that the disease is contracted, not by the children. Of course, the children get it through the mothers, but about mothers. How do you contract this disease? I think he has already indicated that we could probably stop it if we could do the things that we have to do. But now, how do you contract this disease?
Well, the ways that a person contracts HIV is through basically through sexual contact with an infected person. And also a person who has shared infected or dirty needles with another person, and that person was infected. The mother passes it on to her child, and then the child has a chance of becoming infected. And in some rare cases now, because of the blood transfusion. And in a few cases where not so much in America, but in other countries, where the mom who was breastfeeding has now passed it on to their child. But still, the ways that a person becomes infected is basically standard. We've found out those 4 ways, and not many more have come up. I know there's lots of controversy back and forth on different other areas of entry and how that could happen. But basically, if we were anyway to avoid those 4 main ways.
And those 4 main ways are, again, because I think we need to repeat it time and time again, because those are the basic ways in which persons contract this disease.
Right. Through sexual contact.
Sexual contact.
With an infected person. Through the sharing of infected or dirty needles from a mother to her baby. And from a breastfeeding mother to her baby.
Might point out, and it's been interesting, that the anecdotes that have come down and the media does pick up. Of course, we have the infamous case of the dentist in Florida, and that's always a question that people have. And there's still no definitive answer on that. We know that some of the people who showed up positive, who were his patients, had high-risk behavior and probably had infected themselves outside of his office. There's still 1 or 2 that the jury's not back on. The 2 that come most clearly to mind, though, about a year and a half ago, there were very closely together 2 sets of brothers, 1 positive, 1 negative in both households, and the negative brother showed up positive, literally out of the clear blue sky. And of course, this caused a great furor in the media, because immediately we had to question the casual contact question. In both cases, it was very definitively proven exactly how the disease was passed. And so, and they tie in with what Pam was saying. 1, the 2 brothers shared a safety razor. Well, anyone who's ever shaved with a safety razor knows the odds of cutting yourself and collecting blood on that blade is no different than a syringe. And that's exactly what happened. 1 brother shaved, who was infected, the other brother shaved, cut himself, and you have an automatic passage of blood. The other 2 brothers did something equally, I'm going to say stupid, it's not a nice word to use, but they shared a toothbrush. Now, to me, sharing a toothbrush is really extreme. But in brushing teeth, you do open up small wounds in the gums, and it's exactly what happened. You have an infected brother, blood on the toothbrush, passes it to his brother, and he infected himself. There's still no proof, has never been a case of casual contact of transmission of the disease. And by casual contact, we're talking the basics: hugging, shaking hands, sharing utensils, sharing households, typewriters, telephones. It simply, there has never been a reported case of transmission through these means.
You know, one thing I think, Ms. Emmons, that we find, and again we go back to your experiences as a nurse, a person working with persons who are infected with this disease, one thing we find is that and I think you mentioned earlier the denial factor, and I think that and what we'd like for you to talk about today is not only the denial factor on the part of those who might be infected with the disease, but also the denial factor in terms of the family out of which those persons come. For example, we often find that a person will die of this disease, but the newspaper and others will indicate that it is something else entirely, given the impression that that was not, that AIDS was not the real cause at all. What do you say about that, and what have you found in reference to that?
I was going to say that, to be true, we found in a lot of our experiences that even after the patient is diagnosed